teams across Ontario remained on the front lines of patient care, responding to and navigating the diverse health issues confronting our communities. We're pleased government is taking the opportunity to acknowledge the incredible potential of pharmacy teams and is engaging our expertise to support better health outcomes for patients and all Ontarians. Thank you once again, Deputy Premier and Health Minister, for joining here today.
Well, thank you very much, and good morning, everyone. It is a pleasure to be here at Mortal and Pestle and a wonderful community pharmacy right here in Toronto. Thank you for welcoming us today and for everything you do in your local community. On behalf of Premier Ford and our government, I want to offer our appreciation to our province's pharmacists, clinicians, and all healthcare workers. We saw how pharmacists play a critical role administering vaccines to Ontarians in their communities. And we are very grateful that you are a willing partner in ensuring Ontarians can access healthcare in a very convenient way in their neighborhood. The best way for Ontarians to stay healthy as the weather gets colder and to protect one another from COVID-19 and the flu is by staying up to date with your vaccines, which includes both your flu shot and your bivalent COVID-19 booster dose. A healthier population that is protected against respiratory illnesses will mean fewer hospitalizations, to allow hospitals to continue to provide care to those who need it most. Today, I'm pleased to announce we are taking another step to make it more convenient and faster for Ontarians to access care. Starting this Monday, December the 12th, pharmacists will be able to prescribe the COVID-19 antiviral treatment Paxlovid in local pharmacies across Ontario at no cost to the patient. By increasing access to these treatments in more convenient ways, we are helping to keep people healthier and reduce COVID-19 related hospitalizations. Paxlovid prescriptions will remain available through other channels with our primary care providers and clinical assessment centers. This change will expand access and offer increased protection to our most vulnerable and mitigate pressures on the province's hospitals. Vaccination continues to be the most effective way we can protect ourselves and our loved ones from the most serious effects of COVID-19, as well as the flu, which is why healthcare professionals continue to strongly recommend that all Ontarians stay up to date with their COVID-19 vaccinations, get your flu shot, and wear a mask indoors in crowded settings. When we are all working together to make and accessing healthcare easier and more convenient for Ontarians, the whole healthcare system benefits from this collaboration. Thank you again for welcoming me here today, and stay well. I would now like to turn it over to Justin Bates, CEO of the Ontario Pharmacists Association.
Well, good morning, and it's such a delight to be here. This is a fabulous community pharmacy serving patients as a healthcare community hub, and I want to take this opportunity to thank the Deputy Premier and Minister of Health, Jones, and the government for recognizing the role and the value that pharmacy professionals play every day in expanding access to what is a very important treatment for COVID symptoms called Paxlovid. This is something that we build on the work that we've been doing for the last several months in dispensing Paxlovid and dealing with some of the complexities and the drug-to-drug interactions, which really leverages the pharmacist's expertise, training, and education. Now we can reduce the barriers to make sure that more Ontarians have access to this important medication. And what we're trying to do with all of this is work together in an integrated fashion with all of the healthcare providers to make sure that Ontarians can get the medications they need when they need it. And what's really important is to continue to work collaboratively with government and all stakeholders to come up with solutions that create capacity in our healthcare system. We know that by using Paxlovid within 5 days on the onset of symptoms, that we can prevent severe symptoms, and our ultimate goal is to prevent hospitalizations. And by doing that, we release some of that burden in emergency departments, in hospitals, and ICU units. I also want to take the opportunity just to say how proud I am as CEO of the Ontario Pharmacists Association, representing community pharmacists across the province who have really stepped up and provided solutions to this healthcare crisis. They've been doing vaccinations, testing, and continuing as community healthcare hubs to serve their patients and help manage their health. We're going to continue to work collaboratively with government on issues around prescribing authority and other potential opportunities to give patients more community-based access to care. And we know this can be done, as we have seen in other provinces and as we have seen in Ontario, safely and effectively. So once again, I thank the government for recognizing the role of pharmacy professionals, and we look forward to successfully implementing this program, providing pharmacists with the tools and resources they need to be successful in optimizing this in their pharmacies and serving Ontarians across the province. So thank you.
All right, we'll now begin to take questions from the media. If media could form their best line they can behind me in the scrum mic. As a friendly reminder, the format is one question, one follow-up.
Morning, Minister. Liam Casey with the Canadian Press. I'm just looking for a bit more details on the Paxlovid program, like how much it's going to cost, the uptake so far. Are you pleased with the uptake, or is this related to trying to boost the uptake of Paxlovid?
It's really about accessibility. So currently, we have a situation where in Ontario, pharmacies are dispensing Paxlovid, but they are not actually administering it. There are approximately 4,000 pharmacies currently that are doing that. And while it is a voluntary program, we are quite optimistic that there will be many pharmacists that choose to do this because it is another pathway for them to assist their patients directly. So it's really about getting access into community faster. As Justin mentioned, you have to administer Paxlovid within 5 days of experiencing symptoms. So it's really that access that we're improving.
Pediatric hospitals are planning for this respiratory surge to last until March. Just wondering what reinforcements the province has to help out, hospitals besides organizations like the Red Cross.
So many different systems and ideas, initiatives have been started. I have to say that, there is a lot of cooperation between pediatric hospitals like Sick Kids here in Toronto and community hospitals so that they literally, Sick Kids Hospital nurses and physicians are educating and training community nurses so that they understand how to assist those patients who come into community hospitals with RSV. And that work has continued. I got to give a shout out to them because it is an innovative way to make sure that everyone has the same level of expertise. We are doing many different projects. Many of them, frankly, are led by the hospitals themselves. So as they bring forward those innovations, those ideas, we are approving them. As you may know, CHEO in Ottawa, for example, literally within a couple of weeks was able to double their pediatric ICU. We have now permanently embedded that funding to make sure that they can keep that capacity. And we'll continue to do that because we understand the combination of the viruses in the winter season is a challenge in our hospital systems.
Hi, Minister. We have confirmation from the coroner that they're investigating what they say is a sudden and unexplained or unexpected death of a child at Lake Ridge and Ajax on Tuesday. There are some reports that this was a 2-year-old waiting for care who died in a hospital. Died in the hallway. Pardon me. I'm wondering if you can share anything more that you may know about that.
So I am not going to share any additional information. I cannot imagine how challenging this must be for the caregivers, the family of that patient. I will let the investigation and the hospital do the work they need to do to communicate with that family. But, I don't think any of us can comprehend how deeply saddened we are when we hear about the death of a young patient in Ontario.
What message do you have for parents then who might be hearing that and worried about what outcomes might be possible for their child if they need to turn to a hospital in this moment?
As a caregiver, as a parent, if you believe that you need to take your child to an emergency because you are not familiar with what is happening or are you concerned for their welfare, absolutely do it. There is nothing that we should be doing as leaders to suggest that individuals should hesitate at all if they believe that their child needs to see that physician, that emergency department. I will reinforce, we have seen unprecedented cooperation between community hospitals, between pediatric hospitals, making sure that our most vulnerable, when they need help, are getting that assistance. It has involved a lot of cooperation between hospitals, which I applaud, because there are times when a particular part of the province is going to have a higher incident rate, and having that cooperation, that ability to move patients when necessary to other facilities that perhaps do not see that surge that particular day is a really important way for us to balance the load in Ontario as we experience these surges.
Minister, that story about that 2-year-old dying potentially in the hallway is making the rounds on social media. It's really resonating with a lot of healthcare workers. What's your message to them, these healthcare workers who may have lost faith in your handling of the file?
Well, I'm going to reiterate what I say all the time when I am visiting hospitals, when I am in community, just reinforcing how much we appreciate, we value, we see the work that they are doing. Look, there is no doubt that it's very challenging as a healthcare practitioner to see young patients, to see a rise in whether it's flu or RSV, COVID-19, experiencing that surge in their community hospitals. But I really want to reinforce that these are incredibly dedicated, incredibly talented, educated people who have stepped up and continue to step up through what has been a very challenging virus season.
There's also been reports that McMaster Children's won't be able to staff its new ICU beds. Why is that the case if there's been no mass exodus of nurses, as you said?
Well, as I said the last time I was asked, the numbers that we are seeing from the Colleges of Nurses of Ontario show that not only are we bringing on far more nurses into the system than we have seen historic high numbers by doing things like what we talked about in July and August, where we asked the College of Nurses of Ontario to assess, expedite, process, and when appropriate, license individuals who, as an example, were educated and now want to practice in Canada and Ontario. We've done that work, and we're seeing that the numbers of nurses who are now licensed in the province of Ontario has increased dramatically. What we are not seeing, again through the College of Nurses, is a spike in the percentage of individuals who choose not to renew their license. I am not in any way suggesting that this has been an easy path, but what I am saying is for months we have been working with our partners, whether it is hospitals, the College of Nurses of Ontario, CPSO, to make sure that we bolster as quickly as possible the number of physicians, the number of PSWs, the number of nurses that are practicing in Ontario.
Hey, good morning, Minister. Just on access to abortion care in Ontario, a colleague of mine has been looking into access in this province and found that some clinics are underfunded, forcing them to ask for donations from patients or charge user fees. The Ministry of Health has indicated to the federal government that the model for abortion care funding is going to be changing. Can you outline any of the details in terms of what the province's plans are for abortion care funding?
What I can tell you is, as has always been the case, abortion is an OHIP-funded service that is available in community clinics, in hospitals, and in some cases in primary care physicians' offices. That has not changed, and that will not change.
But in terms of the clinics themselves, a lot of them say that they're struggling, and some of them say that they're at risk of closing because they don't have enough funding for the overhead, the operation of the actual clinic itself. Is that funding model going to change? Because it seemed like the federal government, the province was indicating to the federal government that you're looking at potentially funding those clinics for their overhead charges.
We have made no changes to how OHIP, my apologies, how abortion is funded through the OHIP system, and we have no intention of making changes to how it is funded. Thank you.
All right, and this will be our last reporter.
Hi, Minister, or Justin maybe, around the corner. I'm not clear on how many pharmacists are actually going to be doing this, because the Minister was saying they can opt in. So there's 4,000 pharmacies, just trying to avoid a situation where people start popping into pharmacies and expecting Paxlovid to be prescribed on the spot and can't get it. So how do pharmacists opt in? How is this going to be communicated? Or do they just have to decide, yes, I want to do it, and send in a form?
Great question. And one of the things that we're going to do as the association is to support them with all of the communications, tools, and resources they're going to need to implement this in their community pharmacies, including some additional education CE training that we're being made available. So as of today, we will be sending out a communication that talks about the program, builds on the success of the dispensing element of this that we've been doing for several months. And our expectation is that the majority of pharmacies will take this on, but they'll have to look at their patient population and individual circumstances to make that determination, and we'll be with them walking side by side to help them.
So will pharmacists be deciding over the weekend whether they're going to do this? Or, what can people expect on Monday? How many pharmacists might actually be doing this?
Yeah, I don't know if we can give an exact number at this point. We'll be communicating with all of our members in the broader community pharmacy sector on the details of the program and what the expectations are with the policy guidelines and the funding that comes with this. So that will, I expect, encourage people to participate. And I think you'll see the majority step up, as they have throughout the pandemic, to provide solutions and help their patients, because we know just how important this treatment is to preventing severe symptoms and avoiding hospitalizations. So like pharmacists have done throughout the pandemic, they will continue to step up in this manner.
All right, perfect. Thank you. That concludes our event.